A 68-year-old client with COPD arrives with increasing shortness of breath, respiratory rate 32 min, use of accessory muscles, and oxygen saturation 86% on room air. Which action should the nurse do first? A. Administer albuterol nebulizer. B. Apply oxygen via nasal cannula at 2 Lumen minute. C. Obtain arterial blood gas, ABG. D. Position the client in high Fowlers. Pass 1. Read the question. Read slowly. Identify COPD, RR32, accessory muscle use. SpO2 86% on RA. Pass 2. Keywords what it's asking. Keywords first priority, SpO2 86%, hypoxemia, acute distress. The question tests ABC's airway oxygenation. Pass 3. Answer and rationale. Correct B. Apply oxygen via nasal cannula at 2 Lumen minute. Rationale. Hypoxemia, SpO2 86% needs immediate correction. Applying oxygen is a first rapid intervention to improve oxygenation. In COPD, avoid high flow initially, start low, tool NC and reassess. Why the others are wrong, tempting. Helpful, but not the immediate first action. Oxygen first. Student may pick this because bronchodilators help COPD, but you must correct hypoxemia immediately. Important for assessment, but not the immediate intervention. Treat first, then evaluate. D. High Fowlers. Positioning helps, but oxygen immediate is higher priority than repositioning alone. Nclex tip. When you see a low SpO2 and first, oxygen comes before diagnostics or meds that take longer to act. A client on continuous heparin infusion for PE has an APTT of 110 seconds, therapeutic range 60-100. The nurse should A. Stop the infusion immediately and call provider. B. Decrease the infusion rate per protocol. C. Increase the infusion rate to reach therapeutic range. D. Continue the infusion and recheck APTT in 6 hours. Pass 1. Read the question. Note, heparin infusion APTT 110, slightly above range, asks what nurse should do. Pass 2. Keywords. Keywords. Continuous heparin infusion, APTT 110, mildly high, therapeutic range 60-100, what nurse should do now. Pass 3. Answer and rationale. Correct. B. Decrease the infusion rate per protocol. Rationale. APTT above goal often requires decreasing infusion rate or holding briefly per facility protocol to reduce bleeding risk. You don't stop immediately unless massive bleeding or very high value. Why the others are wrong. Tempting. A. Stop immediately. Too aggressive for a slightly elevated APTT. Stopping risks thrombosis. Would be chosen if major bleeding or very high APTT. C. Increase. Wrong. Increases bleeding risk. D. Continue and recheck in 6 hours. Unsafe. Action required sooner per protocol when above range. Nclex tip. For drips with labs, follow protocol adjustments. Increase, decrease. Rarely is do nothing correct when lab is out of range. A client receiving IV potassium chloride complains of muscle weakness and has peak T waves on ECG. The nurse's priority action is A. Slow the IV potassium infusion. B. Administer IV calcium gluconate. C. Give oral potassium chloride. D. Draw serum potassium level. Pass 1. Read the question. IV KCl muscle weakness, peak T waves, signs of hyperkalemia. Pass 2. Keywords. Keywords. Peak T waves, muscle weakness, priority action. Pass 3. Answer and rationale. Correct. B. Administer oral calcium gluconate. Rationale. Peak T waves indicate potentially life-threatening hyperkalemia affecting cardiac conduction. IV calcium stabilizes cardiac membranes immediately. After that, shift potassium intracellularly, insulin plus glucose, albuterol, and remove K+. Why the others are wrong, tempting. A. Slow infusion. Stopping slowing addresses cause, but first priority is cardioprotection. C. Oral K would worsen. D. Draw K level. Useful, but don't delay treatment for labs. Nclex tip. ECG changes take precedence. Stabilize the heart calcium before definitive K removal. A post-op client following abdominal surgery is drowsy, RR6 min, shallow respirations, and pinpoint pupils after receiving morphine PCA, which is the priority nursing action. A. Administer naloxone. B. Encourage deep breathing and coughing. C. Call the surgeon. D. Increase supplemental oxygen. Pass 1. Read. Post-op, opioid PCA, RR6, pinpoint pupils, opioid overdose. Pass 2. Keywords. Keywords RR6, severe respiratory depression, pinpoint pupils, priority. Pass 3. Answer and rationale. Correct. A. Administer naloxone. Rationale. Opioid reversal with naloxone is priority for life-threatening respiratory depression. While oxygen helps, naloxone reverses opioid effects quickly. After reversal, monitor airway and breathing. Why the others are wrong, tempting. B. Deep breathing, not effective. Patient is too depressed to cooperate. C. Call surgeon, passive and not immediate life-saving action. D. Increase O2, helpful adjunct, but does not reverse opioid-induced respiratory depression. Naloxone does. Nclex tip, signs, pinpoint pupils, low RR, think opioid, reverse the cause, naloxone when life-threatening. A 32-week pregnant client arrives with sudden severe abdominal pain, vaginal bleeding, and a rigid board-like abdomen. Fetal heart rate is 80 BPM. What is the nurse's best action? A. Prepare for immediate cesarean birth. B. Start an oxytocin infusion. C. Insert internal fetal monitor. D. Encourage the client to ambulate. Pass 1. Read. Preterm 32, BODU, sudden pain, bleeding, board-like abdomen, FHR 80, fetal bradycardia. Pass 2. Keywords. Rigid abdomen, fetal bradycardia 80, sudden severe pain, classic placental abruption with fetal distress requiring immediate delivery. Pass 3. Answer and rationale. Correct. A. Prepare for immediate cesarean birth. Rationale. Placental abruption with non-reassuring fetal heart rate, 80 BPM, is an obstetric emergency. Emergent delivery, usually C-section, to save fetus and mother. Why the others are wrong. B. Oxytocin would worsen abruption. C. Internal fetal monitor is not priority. D. Ambulate is dangerous. Tip. Board-like uterus, pain abruption. Think immediate delivery. STEM. Which task may be delegated to an experienced, unlicensed assistive personnel? A. Reinforce teaching about insulin injection technique. B. Obtain a capillary blood glucose for a stable diabetic. C. Assess new onset shortness of breath. D. Administer oral hypoglycemic medication. Pass 1. Read delegation question. Choose what UAP can do. Pass 2. Keywords. UAP, experience, tasks listed, teaching, obtain capillary BG, assess, obey, administer med. Pass 3. Answer and rationale. Correct. B. Obtain a capillary blood glucose for a stable diabetic. Rationale. Obtaining capillary blood glucose is a stable, routine task within UAP scope, depending on facility policy. UAP cannot perform assessments, initial teaching, or administer medications requiring clinical judgment. Some facilities allow med techs, but Nclex generally says no. Why the others are wrong, tempting. A. Teach insulin technique. Teaching requires RN skill and evaluation. CSS obey. Assessment is RN responsibility. Oral hypoglycemic. Medication administration usually RN responsibility, unless facility permits med techs. Nclex errs on RN. Nclex tip, delegation equals ADL's vitals basic data collection for stable patients. RN retains assessment, teaching, clinical judgment. STEM, a 59-year-old male with chest pain arrives. He's diaphoretic, anxious. 12-lead ECG shows ST segment elevation in leads 2-3 ABF, BP 110/70, HR 98. What is the immediate priority? A. Give sublingual nitroglycerin. B. Prepare for emergent percutaneous coronary intervention, PCI. C. Start a beta blocker. D. Obtain troponin level. Pass 1. Reading for your STEMI 2-3F immediate priority. Pass 2. Keywords T elevation. Immediate priority. Revascularization time critical. Pass 3. Answer and rationale. Correct. B. Prepare for emergent percutaneous coronary intervention, PCI. Rationale. STEMI requires rapid reperfusion, PCI within guideline time window. While nitroglycerin can relieve ischemic pain, the priority is reperfusion. Prepare for cath lab and call cardiology. Activate STEMI protocol. Why the others are wrong, tempting. A. Sublingual NTG. Helpful for pain ischemia, but not definitive treatment. May be used if BP allows, but reperfusion is priority. C. Beta blocker. May be indicated, but not immediate priority when PCI is needed. D. Troponin diagnostic, but waiting delays treatment. Do not delay reperfusion. Nclex tip for STEMI, choose reperfusion. PCI TPA as priority when available. STEM. A client with UTI suddenly becomes hypotensive, BP 82/46, tachycardic 130, temperature 39.40 and confused. The nurse suspects septic shock. Which is the nurse's first action? A. Administer broad-spectrum IV antibiotics. B. Start large bore IV fluids, crystalloid bolus. C. Insert a Foley catheter to measure output. D. Obtain blood cultures. Pass 1. Read. Sepsis, hypotension, tachycardia, fever, confusion, management priorities. Pass 2. Keywords. First action in septic shock, hypertension. Pass 3. Answer and rationale. Correct. B. Start large bore IV fluids, crystalloid bolus. Rationale. In septic shock with hypertension, initial resuscitation is aggressive IV fluids to restore perfusion. Concurrently, antibiotics and cultures should be obtained, but immediate life-saving fluids are first. Why the others are wrong, tempting. A. Antibiotics, critical and should be given within the hour, but fluids to restore BP are immediate. Useful but not priority. D. Should be drawn before antibiotics if it doesn't delay treatment, but fluids are first to treat shock. Tip: in sepsis with hypotension, fluids first to support circulation. Do blood cultures and give antibiotics promptly after. STEM: a 4-year-old child arrives after a scald burn from hot water covering the anterior chest and both arms. Depth, partial thickness, estimated 12% TBSA. The child is in pain and crying. Which action is highest priority? A. Apply antibiotic ointment and sterile dressing. B. Start IV fluids per pediatric burn formula. C. Give oral ibuprofen for pain. D. Obtain tetanus immunization status. Pass 1. Read. 4-year-old with partial thickness burns anterior chest plus both arms is 12% TBSA. Priority. Pass 2. Keywords. Keywords: TBSA 12% partial thickness pediatric. Think fluid needs for 10% TBSA in children. Pass 3. Answer and rationale. Correct. B. Start 4 fluids per pediatric burn formula. Rationale: children require fluid resuscitation for burns 10% TBSA. Maintaining perfusion is priority. Pain control and wound care follow, but fluids to prevent hypovolemia are essential. Why the others are wrong. Tempting. A topical ointment dressing. Important but not first for 10% TBSA in child. C. Oral ibuprofen. Inadequate alone. Child likely needs IV analgesia and fluids. D. Tetanus. Assess later. Not immediate life-saving. Nclex tip. For burns, adults need fluids 20% TBSA. Children 10% TBSA. Remember, pediatric threshold is lower. Client tells the nurse, "I can't take this anymore. I'll kill myself tonight." The client has a detailed plan and access to pills. What is the nurse's next action? A. Ask the client to sign a no-suicide contract. B. Notify the provider and begin one-to-one continuous observation. C. Encourage the client to use coping strategies. D. Place the client on PRN sedative medication. Pass 1. Read. Explicit suicidal statement with plan and access. Immediate safety issue. Pass 2. Keywords. Keywords: detailed plan, access to pills, next action, imminent risk. Pass 3. Answer and rationale. Correct. B. Notify the provider and begin one-to-one continuous observation. Rationale: immediate safety, one-to-one observation, continuous, and notify provider for further interventions, psychiatric evaluation, removal of means, possible involuntary hold if required. No suicide contracts are not protective and are outdated. Counseling and meds are secondary. Why the others are wrong. A. No suicide contract, not sufficient and not evidence-based as sole intervention. C. Encourage coping, important but not immediate, safe environment first. D. PRN sedative may be used but not first line. Observation and provider notification to arrange definitive care take priority. Nclex tip: when client states imminent plan plus means, immediate constant observation and remove access to means. Safety